Okay, cool. Well, welcome. So it's just kind of cool. We'll just chill and just have a conversation.
Okay.
So I just want to introduce you. This is Madeleine, and you were damaged by fluoroquinolones.
All right.
So you've gotten really great results with everything that we've done. So I appreciate you coming on, and the community is going to appreciate it. And just so you know that somewhere around the world, someone's going to be watching this video of you, and they're going to realize that they have like hope and possibility to get better.
Yes, exactly. Yes.
So I took some notes here, so I might be looking at my notepad a little bit. So just kind of tell the audience like what happened. I had some notes in 2008 and then 2019 and then 2020 that I think those were the times that you kind of took the fluoroquinolones or the antibiotics.
Yeah, exactly. So in December last year, I had a urinary infection. I mean, my doctor didn't do all the tests to see if I had the infection, but she prescribed me Cipro, and without having the results of the infection. And then I took Cipro for 5 days, and I had to stop it because I start to have side effects. And it was prescribed for 7 days, but then I was not able to continue the treatment.
And you went in because you had a UTI, right?
Yeah, I thought I had a UTI.
Yeah. I mean, this is so classic. If you're a woman, you go in for UTI. Oh, you got pain when you're urinating or something like that. They give you this antibiotics, and then they have the test results 2 days later, and you're already damaged.
Yeah, exactly. Yeah. Because they say you just start to take it right away.
Yeah, and the test was negative. You didn't actually have a bacterial infection.
Yeah, exactly.
Yeah. So this is classic. This is a classic symptom of a woman, UTI. Men, they go in with so-called like pain down in their prostate. They don't do the check. They don't check for blood work. They give them the medications, and then 2-3 days later, when the test comes back negative, if they actually did a test, they're already damaged.
Yeah, exactly. Yeah.
It's too late. So give the audience here, what kind of problems were you experiencing? So here I had that you couldn't walk, heels hurt, heart palpitations, noise sensitivity, sleep, chemical sensitivity, and you had some constipation problems. So just kind of give the audience like how bad was your condition so they can see like, okay, Madeleine was here. And now after we did a program which is very specifically designed towards your needs, now you're functioning here. So let's get how bad it was before you started.
Yeah, so the first I was not able to walk for 3 weeks because I had pain in my calves, in my tendons, and I was not even able to shower because all my joints were cracking, and I had pain in all my muscles, spasms, and I was feeling like needles everywhere. I lost also a lot of weight. In 2 weeks, I lost 7 kilograms, which is 15 pounds, I think. And I was feeling that I was melting, so I didn't have a lot of strength. And I had also brain fog and difficulties to focus, and also noise sensitivity. I was not able to watch TV or to listen to music. It was really scary. And I had also insomnia and digestive problems. And the worst, it was food sensitivity and chemical allergies. I was sensitive to gluten and proteins and chemical allergies, toothpaste, and everything that we use daily, shampoo. It was really an issue.
Yeah, I mean, so if you just listen to that, if you're listening to this video, you might want to go back and re-listen to all these problems that Madeleine had, because that's like insane amount. Like you couldn't shower, You couldn't walk. Like, how did you get around in the house? Did you have a walker? Did you just limp?
No, I was on my knees just to go to the bathroom.
Oh my
Yeah,
goodness.
yeah,
Okay.
yeah.
Wow. Okay. So you're on your knees. How often were you going to the bathroom? How often were you making like a bowel movement?
Every 2 or 3 days.
Okay.
Yeah.
So that's not good, because when the poop
Mhm,
doesn't get, when the poop stays in your body, then that's more toxins on your
mhm.
body to start with. And how bad was like your brain fog or brain fatigue?
It was really difficult to focus because I was working and I had to take some weeks off because
Hmm.
I was not even able to write an email, a regular email, or
Wow.
to speak about the weather. It was, for me, it was, I needed so much energy and I didn't have the energy and the focus. It was really, really bad.
Wow. Yeah, for sure. And then one of the things is, like, you talked about oral tolerance. Like, what kind of um, what kind of problems did you have to, like, chemicals and that kind of thing?
Chemicals, I was not able to use toothpaste, shampoo, um, nothing related to what we use daily in the house. So, and also I stopped any medication or anti-inflammatory pills.
Mm-hmm.
At the beginning, I tried to use essential oils for my pain, but I had a bad reaction also to essential oils, and I was having palpitations and yeah, it was I was not able to take anything.
Yeah, I think that's really common for a lot of people that have been damaged, is their immune system or nervous
Mhm.
system just becomes like, it fires just so easy. Like, it's just like your immune system should build up and then fire. But I think when you're damaged, like your immune system and your nervous system is just
Mhm.
firing all the time. And
Yeah.
this is like, people have anxiety, they'll have heart palpitations, and just be really, really scared overall.
And the worst is that I went to the hospital and they did blood tests and they couldn't find anything, and they sent me home with anti-inflammatory pills, but I didn't take them because I knew that it can get worse if
Right.
I take them, and they said there was no, I was okay, but I was
Yeah.
not okay.
Right. Yeah. That's common. That's really, really, really common. So, yeah. So one of the things, what about your sleep, Madeleine? Tell the audience about how bad your sleep was.
I was not able to sleep a few nights in a row, so it
Mm-hmm.
was really, really bad because I had sleep problems in the past and I was using sleep pills, but staying awake for like 48 hours and more, it was really
Oh,
weird. Yeah, it was really weird because I felt tired, but I was not able to
sleep.
sleep.
Mm-hmm.
Yeah.
Wired and tired, they call it. You're wired
Mhm.
like, you're wired like this and tired, but you can't sleep. Oh,
Exactly. Yeah. Yeah.
yeah.
Because I was feeling palpitation each time I was trying to fall asleep.
Like in your
My
chest
body.
area.
Yeah. Exactly.
Mm-hmm.
Yeah.
Yeah. Wow. Okay. So we've been working together, I think, for about 3 or 4 months now. Just tell the audience, like, now, like, what's your situation now? What's happened? What's changed? Give people hope, possibility that if
Hmm.
Madeleine can get better, way up in Canada, right? You're in Canada, I'm here in the United States. Like, there is hope for you out there. If you're listening, if you're seeing Madeleine and you're having these problems, I just want to let you know, like, Madeleine came on here, and like, there's possibility for you to get better. God created us to be healthy, and we put all these chemicals in our body. So we came up with a program. We did some testing. We sent you the organic acid test, a mold test. um, so just tell them now, like, how your life is like now, which is really exciting.
Yeah. So now I am able to walk without having pain. I was able to walk for 3 hours, and that's crazy because at the beginning I was not able to leave the house. So it's really impressive, and I don't have the brain fog, the noise sensitivity. Um, I can sleep now. I can sleep 12 hours if I want. I don't have this issue anymore. I don't have palpitations anymore. Yeah.
I mean, I don't know if you can see, but that, I don't know, my arm, I don't know, that gave me goosebumps. Like, seriously, like, this is why, like, I put all this time in this content researching this. Like, I mean, what you just said there, it was just, I mean, it's mind blowing on what happened when a program's developed for your specific needs on what's happening. I mean, you go from walking 3 hours to, you know, you're walking 3 hours where you were crawling to go to the bathroom.
Exactly. Yeah. Yeah.
I mean, and then you had sleep problems. I mean, it's just, I don't know, it's literally amazing. And, you know, a couple key things I think that we found, well, there's a lot of things that we found, but you sent me some blood work from Canada. And I really remember this because the copy that you sent me, it was on iron. It was a ferritin marker, right? And I think it said 8, and then there was a little like blurry L. And I think I even questioned you on that. I said, is that a ferritin level?
Yes.
Because it wasn't very clear. And then you said, yes, that was ferritin. And that was like an iron, a low iron status.
Yeah, very low.
Very low. But yet in the conventional system, it's like, you know, they don't even tell you about it. And I think that you said that you were trying to take iron before.
Exactly.
But it didn't work for you, right?
It was not good for my digestive, for my digestion. Yeah, I was not able to take iron. Yeah.
Take iron. So we fixed your gut, and then we gave you a very specific liquid iron, which I think was like completely revolutionizing like your care.
Yeah, exactly. Yeah, and I don't have digestion problems with this one. Yeah.
Yeah, right. So that was really, really, really critical. So, okay, well, that's pretty awesome. I'm just looking at some notes here. Anything else? You know, what about like your noise sensitivity? Tell the audience on like, because this is really common, like noises, like what was bothering you and what can you do now?
I think this was the first time when I had this noise sensitivity, because it was really bad. I was not able to even to speak on the phone. It was so disturbing, and it gave me like anxiety. So now I have no issues. It's just disappeared.
Wow, that's amazing. That's incredible.
Yeah. Yeah.
All right. Well, cool. Well, anything else you want to say to the audience, Madeleine, while you're here and you're going to be making an impact on people's lives?
I think they should go for help, and because we have so many stories on the internet, but if you don't find the right supplements that work for you, it's very difficult to heal, because it was also my case. There are supplements that I can't take, or they have to take a different dose. So it's really important and don't take it slowly. Don't take everything, all the supplements that you find, because your health can be worse.
Yeah, that's perfect. I think one of the things is, like, when people come to me, like they're searching for, like, how can we take out the confusion? I'm just like a guide, right? I have all this clinical knowledge. So then I can look at Madeleine's case or whoever's case, and I can say, okay, let's do step 1, which is easy. Let's do step 2, which is easy. Let's do step 3, and let's work in this pathway. Let's be in communication and figure out what's going on. I think another key thing is you have to find a provider that's like on your side. Like they believe you, they believe this is a problem, and they want you to get better, and they just don't think it's like all in your mind, or like you're crazy or something like that.
Exactly, because normal doctors, they will say, I'm fine, I'm perfectly healthy, and that maybe I'm exaggerating, or
it's all in your head. There's no way this can be happening. Here's some antidepressant medication pills.
Exactly. Yeah. They can't really, because they have the blood test and they say, oh, it's fine, but they can't really understand if you are in contact with some products and then 5 minutes later, you start to have
Reaction.
reaction, or you eat something, processed food, and also you have a bad reaction because they don't see it. I mean, you have all your muscular pain are back, and you are not able to walk, or they don't understand it because it's not like something that they can see on your skin, you know.
Yeah, for sure. Yeah, another thing too that we found multiple things, but another thing too was like low blood pressure.
Yeah.
So just kind of because I was looking at your notes, and a lot of people, you know, they go to the doctor, they say, oh, you have great blood pressure. I think some of your readings were like 90 over like 60 or something like that, right?
Yeah, and I also had 80. It was really low. Yeah.
Good. What?
80.
What was that?
80, the blood pressure. I had 80.
Oh, 80.
Yeah, exactly.
Yeah. Okay. So yeah, your blood pressure was low. So, you know, one of the things I'm finding a lot when people are damaged, they actually have low blood pressure. So just to give the audience like a scenario of what's happened with you is you had a bad gut, you had your immune system, your nervous system wasn't functioning well, you had poor iron status, and then you had poor blood pressure. So if you don't have enough blood pressure is what pushes oxygen up to your brain. It pushes oxygen into your muscles. It pushes oxygen into your gut. So if you don't have enough iron, which delivers oxygen, and poor blood pressure, you have a toxic soup is what you actually had. So we worked on multiple things, and we were able to pull your blood pressure up a little bit.
Yes, exactly. Now it's much higher than what
awesome.
I had before. Yeah.
All right, well, cool. Well, I really appreciate you doing a success story here. The community will appreciate it, and just let you know, you're going to make an impact in someone's life that's going to watch this video. Any last words that you want to pitch out there to give someone hope, possibility?
Yeah, I want people to know that you can heal. You can heal. It's possible. Even at the beginning, it's really difficult, and you don't see the light at the end of the tunnel. You can really heal.
All right, sounds good. Ciao, ciao. Thank you.
Thank you also. Bye.
Bye-bye.